So for another aspect of childbirth and all, trying to look at the health of the mother and the baby, what could actually happen if your mother is smoking? They call that maternal smoking. What could happen if your mother is a smoker? All right. So maternal smoking, this is just it. Maternal smoking during pregnancy. We are now basically trying to talk about the risks, right? It poses serious risk to both the mother and also the baby that is just coming up. All right. So just so you know, cigarettes contains about 4,000 chemicals, including carbon monoxide and nicotine. All right. So these chemicals, they can cross the placenta. Yes, they are lipophilic. They can cross the placenta, affect the baby. They reduce the amount of oxygen that is reaching the baby. Now, because oxygen is not reaching the baby is not relaxed. All right, it's causing the baby's heart to beat too much. That's tachycardia. So you are stressing the baby. Anytime you see a pregnant woman smoking, she's stressing her baby. Now, this could lead to a lot of complications, which we'll actually be talking about. So what is the health risks on the baby? All right, if a pregnant woman is smoking, what is the risks on the baby? The baby will be born, but their weight to be lower than their age mates. Okay, preterm birth, intrauterine growth restrictions, stillbirth, sudden infant death syndrome. They could just die later on when you give birth to them, but they are now still having those complications. So just wake up one day, your baby just die, just like that. There's no cause. You understand? It's when you take medical history, you find out that the mother was smoking when she had this baby. Neonatal respiration and gastrointestinal issues. There's higher risks of what? You admitting this baby in the intensive care unit after you give birth to the baby. That's if the mother was smoking. So long-term effects, they could develop asthma and chronic respiratory conditions later on in life. Yes, the effect lives with the baby forever. All right. They could experience behavioral delays, cognitive delays. Their mates are already speaking, they are not speaking, and when these children get into school, they perform poorer. Yes, this is something very serious. Okay, they can suffer from obesity or metabolic disorders later on in life. All right. So prevalence trend in 2021, 5.4% of women reportedly were still smoking in pregnancy in USA's. All right. 56.1% of women who smoked before pregnancy quit during pregnancy. Most of them, they just stop. They love for a baby and all of that, but it's still crazy mothers that still go on. So smoking rates varies widely based on regions. Okay, of course, those French countries that they smoke so much, like others in France, it should be high. So quitting smoking and why it matters is, if you stop smoking, it improves the amount of oxygen reaching your baby, makes your baby grow healthier. It reduces risk complications during pregnancy, after pregnancy, and even when your baby grows. Okay, so you don't want to born somebody that is just suffering all their life on something that you would have just stopped. Okay, now it leads to a healthier birth and better long-term outcomes. So on an average, for me, I would say that I actually prefer people that drink and people that smoke. All right, cigarettes, be cigarettes or weed, or worst, cigarettes. Do you understand? So there's actually no point for that. All right, there's no amount of enjoyment you want to do now and suffer later. Do you understand? That's not enjoyment. All right, so that's it for maternal smoking.